Hi everybody, Dr. Britt Talley Daniel MD, and I'm a neurologist and headache doctor. And today I'm creating a YouTube video on the subject of a list of migraine comorbidities. Now the word comorbidity refers to a greater than coincidental association of two conditions in the same individual. It means that two medical problems occur together in the same patient more likely than by chance. Migraine is a common medical problem, and for women is the most prevalent illness women have. 25% of women and 6% of men have migraine. The most painful conditions are kidney stone, pregnancy, and migraine headache. Migraine is the fifth most prevalent disabling headache or condition, medical condition, and the 10th most frequent reason to go to the emergency room. Migraine headache consists not only of severe, usually one-sided headache, but also sensitivity to light and sound, nausea, vomiting, and disability. Migraine turns on the brainstem generator for nausea. It makes a person nauseated or vomit. Migraine also makes a person want to be still and lie down, usually in a dark, quiet room like a bed, rather than to be up and about. The medical conditions that lead to migraine I'm going to discuss next. Now, this is a list of migraine comorbidities. First, respiratory conditions. The main entities here are allergic rhinitis and asthma, which have about a 17% link to migraine. Allergic rhinitis is commonly called by the man on the street sinus or hay fever. Rhino refers to nose. Think of a rhinoceros. And allergic refers to a genetically inherited condition of overreaction of the immune system to foreign antigens like cedar pollen or cat dander. A commonly idea is that a medical condition exists called allergy headaches, but that's mistaken, and the word allergy is not even listed in the index of the Third International Classification of Headache. Allergic symptoms can aggravate migraine indirectly, but there's no direct allergic pathophysiologic mechanism causing headache. An allergic reaction is an antigen-antibody reaction whereby the antigen is a foreign protein like cedar pollen, and the antibody is another complex protein made by the immune system in the body. This reaction causes mast cells to release histamine, and histamine causes most of the allergic symptoms of the itchy, red, swollen eyes, nasal congestion, sneezing, production of clear nasal fluid, and tearing. These symptoms relate to an allergic condition. The release of internal neurochemicals of CGRP, neurokinin A, and substance P from the arterial and trigeminal nerve ganglia occurs during a migraine headache. And these neurochemicals inflame the cerebral arteries, the trigeminal nerve, and the brain pain center in the thalamus, resulting in a severe migraine headache, and this relates to migraine. Many different chemicals cause vasodilatation and therefore aggravate migraine headache. This is why MSG, which is monosodium glutamate, chocolate, tyramine and aged cheese, and nitrates in hot dogs may aggravate migraine. There's a relationship between the ingestion of these chemicals and headache, but the headache comes because of vasodilatation caused by the offending chemical. That is, chocolate can do that, but not from an allergic reaction like an antigen-antibody reaction, which causes mast cell release and histamine. Thus, for patients suffering from severe allergic symptoms and is stressed by these symptoms and not sleeping well and feeling lousy at work, and if they inherited the migraine gene, they may have indirectly more migraines, but there is no direct relationship between allergic rhinitis and migraine. Next, asthma has a lifetime prevalence with allergic rhinitis of 50 to 100% among adults with asthma in Europe and the United States. Asthma has a strong link to psychiatric problems such as depression, generalized anxiety disorder, and post-traumatic stress disorder. With migraine, the cerebral arteries dilate, but with asthma, the small lung bronchioles constrict, leading to reduced oxygen passage and producing the characteristic and diagnostic asthmatic symptom of the inspiratory wheeze as air tries to pass through a narrow tubular passage. It sounds like that. Adrenaline-type inhalers used to treat asthma may also produce anxiety and panic-like symptoms. Next, cardiovascular diseases. Stroke, particularly ischemic cerebral infarction, is increased with migraine with R by 6%. This risk may be aggravated by taking an estrogen-based birth control pill, such as a pill or a patch or shot. Hypertension is one of the most common risk factors for development of atherosclerotic, which means hardening of the arteries, medical conditions. Hypertension has a 10% link to migraine. Hypertension can also relate to anxiety disorders. Angina and myocardial infarction. Angina is chest-related or arm, chin, back, or neck-referred pain that comes with exertion or anxiety. Angina refers and relates to heart disease. It's the man in Minnesota who shovels snow in his driveway for 10 minutes and gets chest pain. Angina may be stable and not by itself that serious if the chest pain clears with nitroglycerin, but angina establishes a patient has organic heart disease. Chest pain is always serious and should be thoroughly evaluated as relating to the heart, but if the patient has been examined by a cardiologist and has had appropriate testing, he may be given nitroglycerin, a coronary artery dilating medication, to take for the chest pain. Angina doesn't mean heart attack, but it's hard to separate them and important to know which it is. Stable heart disease with angina can be treated, again, with vasodilators and other drugs. The precise biological mechanism by which migraine with or without aura may increase the risk of myocardial infarction is currently unknown, but statistically it is relevant. Raynaud's disease and Raynaud's phenomenon are associated with migraine. Raynaud's phenomenon and disease are neurovascular symptoms relating to constriction and dilatation of small arteries. If a sensitive reaction to temperature change of exposure, usually to cold but also to heat, and emotional events, whereby a person's fingers and toes tingle and then turn white, red, and then blue. Raynaud's disease is associated with and may be a marker for autoimmune medical problems such as lupus, erythematosus, or rheumatoid arthritis, while Raynaud's phenomenon is more benign and occurs without association with other medical problems and is somewhat benign. Migraine is another disorder involving vasoconstriction and dilatation of cerebral arteries. Congenital heart disease. A recent study found an increase in the prevalence of migraine among adults with congenital heart disease. The frequency of migraine was highest among congenital heart disease subjects with right to left shunt, which is found in 52% of patients, followed by those with left to right shunt in 44%. Mitral valve prolapse. The mitral valve is the most common heart condition. This condition is found in 1.5 to 2% of the population, and in most persons doesn't cause symptoms, but it can result from a descent of the mitral valve on the left side of the heart between the small chamber, the atrium, and the large chamber, the ventricle that pumps blood to the body. Mitral valve prolapse symptoms can be chest pain, rapid heartbeat, and anxiety. The relationship between migraine and mitral valve prolapse is uncertain, yet the association has been reported. Patent foraminovaly, PFO, is found as many as 25 persons early in life, and usually spontaneously closes on its own. Yet patent foraminovaly may extend into adulthood and be associated with migraine. In many individuals, as many as 25% or more, however, the foraminovaly may persist unclosed, that means patent or open, into adulthood. A number of studies have suggested that individuals with migraine are more likely to have a patent foraminovaly, PFO, and this association is most evident in those whose attacks of migraine may be accompanied by an aura, that is, migraine with aura patients. The means by which a patent foraminovaly may relate to migraine is not understood, yet there's a statistical relationship between the two, and most of the literature has clustered around PFO and migraine with aura. One theory is that blood components which are normally screened in the lungs would pass through an open PFO to the brain and thereby activate migraine. Surgical closure of the PFO has been associated with a reduction of migraine with aura in some patients, and currently transfemoral cutaneous closure of a PFO is considered to be a viable part of treatment for stroke and migraine prevention. Atrial septal defect is statistically related to migraine, yet less like PFO surgery is not medically indicated. Well, that's an old statement, really. ASD doesn't need closure, but PFOs, now the new data is they should be closed. Endocrinological. Hypothyroidism is statistically related to migraine, and treatment of hypothyroidism lowers the severity and frequency of migraine attacks. Migraine patients should have their thyroid profile studied. Dermatological. Psoriasis is related to multiple medical comorbid conditions, including cardiovascular disease, stroke, ischemic heart disease, congestive heart failure, hypertension, and metabolic disorders, dyslipidemia, obesity, insulin resistance, and type 2 diabetes. Psoriasis also relates to migraine, although how psoriasis increases the risk of migraine is uncertain. One theory is that a link between psoriasis and migraine may be due to endothelial inflammation and nervous system involvement. Gastrointestinal links. GI disorders have an increased frequency of migraine patients compared with the general population. The Helicobacter pylori infection, irritable bowel syndrome, gastroparesis, hepatobiliary disorders, celiac disease, and alterations in the microbiota have been linked to the occurrence of migraine. Several mechanisms involving the gut-brain axis, such as a chronic inflammatory response with inflammatory and vasoactive mediators passing to the circulatory system, intestinal microbiota modulation of the enteric immunological milieu, and dysfunction of the autonomic and enteric nervous system have been postulated to explain these associations, the gut-brain relationship. However, the precise mechanisms and pathways related to the gut-brain axis in migraine are not fully understood, yet there's a large literature linking migraine to GI disease. Irritable bowel syndrome, IBS, is one of the most common GI problems with the relationship with migraine present in 60% of IBS patients. Migraine and IBS are strongly linked to psychiatric disorders such as chronic insomnia, generalized anxiety disorder, and depression. A research study showed that chronic headaches were reported by 30% of people with celiac disease, 56% of those who were gluten sensitive, 23% of those with inflammatory bowel disease, and 14% without the conditions. Persons with celiac disease, gluten sensitivity, and inflammatory bowel disease all have more migraine headaches than people without these conditions. Rheumatologic. Fibromyalgia links to migraine with a 17% comorbidity rate. Both conditions have been found to cause central sensitization, which means inflammation of the main brain pain center, the thalamus. Both migraine and fibromyalgia can cause what's called allodynia, which is the condition whereby touch, which is usually not perceived as painful, is found to be painful. Allodynia is found with stage 4 of the migraine timing cycle, with chronic migraine due to medication of each headache. It's also due to central sensitization because the central nervous system, trigeminal nucleus, and the cutaneous scalp fibers are inflamed. So just to touch the head hurts. After a sunburn, for instance, touching the involved skin area hurts. The touch fibers in the skin of the back or shoulders are inflamed by the burning of the sun. Wearing a shirt or a jacket over a sunburned shoulder or arm would be perceived as painful, not as just touch. Touch of one side of the head during a migraine may also hurt, as the pain sensory fibers are then activated. Activities that may cause pain with allodynia are combing or brushing the hair, wearing a hat, earrings, a necklace, glasses, or lying in bed on the involved side of the head. All of these touch activities may hurt in a person who has allodynia related to medication of headache or fibromyalgia. Chronic migraine has also been shown to increase episodes of pain in persons with fibromyalgia, among other symptoms such as high frequency of headache, sleep disturbances, and anxiety. Light, noise, and touch can act as triggers for both fibromyalgia and migraine. Fibromyalgia and migraine are commonly comorbid disorders. There's a high prevalence of fibromyalgia in migraineurs and a high prevalence of migraine and other headaches in patients with fibromyalgia. Studies have found reports of increased headache-related disability, depression, and headache severity in patients with comorbid fibromyalgia and migraine as compared to those with migraine only. The presence of fibromyalgia has been correlated with lower quality of life in patients with migraine, making it important to screen for symptoms of fibromyalgia in the migraine population. Neurologic conditions. Epilepsy. Migraine and epilepsy are comorbid episodic paroxysmal neurologic disorders. The prevalence of epilepsy is 0.5% and migraine is 12%. 6% of patients with migraine have epilepsy, and 8 to 15% of patients with epilepsy have migraine. A migraine aura may trigger a seizure an hour later. That's called migralepsy, and a seizure may trigger a migraine attack. Research published in Epilepsia in 2013 first investigated the role of genetics in the co-occurrence of migraine and epilepsy. The results showed that a history of migraine with aura was, quote, significantly increased in enrolled participants with 2 or more additional affected first-degree relatives, supporting the hypothesis of a shared genetic susceptibility to migraine and epilepsy. Migraine and epilepsy may both be treated with neuronally active drugs such as Depakote, Topamax, and gabapentin, which says something about the relationship of the inherent brain abnormality of both these conditions. Tension-type headache is found in multiple research studies to be associated with epilepsy. Multiple sclerosis. Migraine occurs 2 to 3 times more frequently in patients with MS than the general population. Clinical overlap between migraine and MS has been recognized since 1952, when a study by McAlpine and Compton observed that 2% of patients with MS developed migraine within 3 months of an initial relapse. A higher overall prevalence of migraine in MS has been supported by multiple controlled and uncontrolled study reporting rates between 21 and 69%. Psychiatric. Mood disorders. Depression may link to migraine 50% of the time and is the most common of associated psychiatric conditions in patients with migraine. Now, depressive symptoms may be mood changes with anxiety, apathy, general discontent, guilt, hopelessness, loss of interest or pleasure in activities, mood swings, or sadness. Behavior changes could be agitation, excessive crying, irritability, restlessness, or social isolation. Sleep may consist of early awakening, excess sleepiness, insomnia, or restless sleep. Whole body excessive hunger, fatigue or loss of appetite, cognitive lack of concentration, slowness in activity, or thoughts of suicide, changes in weight gain, or weight loss with depression, poor appetite, or repeatedly going over thoughts. Depressive disorders occur in patients with partial complex seizure disorders of temporal and frontal lobe origin. Depression is more common in poorly controlled epilepsy and may precede the later development of seizures. Animal studies of epilepsy showed decreased activity of serotonin, norepinephrine, dopamine, and GABA, which facilitates the kindling process of seizure foci, will worsen the seizure frequency and severity, and are reversed or blocked by antidepressant drugs. Dysphoria. Regarding epilepsy, described as intermittent dysphoria disorder between seizures, was first described by Kreplin in 1923 and consists of a set of symptoms found in 17% of people with chronic epilepsy. Dysphoria is from the Greek and means a profound state of unease or dissatisfaction. In a psychiatric context, dysphoria may accompany depression, anxiety, or agitation. The most common symptom of intermittent dysphoria, mood disorder, is intermittent mood in between spells of headache. Can be treated with antidepressants or anticonvulsant medications. Bipolar disorder used to be called manic depressive disorder and consists of alternating mood states of mostly being mildly severely depressed or down, alternating with times of mild or severe mania. Between 25 and 40% of people who have bipolar disorder also have migraine. The exact reason for this is not known, but it's thought that certain aspects of brain chemistry are the same for migraines and bipolar disorder. Migraine drugs, such as Depakote, Topamax, and gabapentin, are helpful for bipolar disorder also. Generalized anxiety disorder can also be associated with migraine. Panic disorder is another condition that can do the same. Chronic fatigue and agoraphobia also associated with migraine, along with ADD and ADHD problems. So this completes my discussion about migraine and comorbidities. I have a long article about this on my webpage at www.migraine.com. God bless all you folks who have any of these medical conditions or migraine. Please click subscribe down there, and I will see you on the next talk.